Is therapy pretty much like it for insurance? Because I know a lot of people don't go to physical therapy because they have such a high copay.
Right.
But when you've had a surgical procedure, or is the insurance company a little bit more lenient?
No. No. Insurance companies, I think, are the bane of our medical existence.
Yes. Yeah, I'm with you.
I believe that they exist for profit only.
Yes, they do.
We have had in our office $5,000 copays for us. We've got it down by jockeying insurance companies, but when you have to pay $3,500 or $5,000 out of your pocket, particularly at times like this when people are struggling, it's almost impossible. People hear a lot about I'm glad we don't have a Canadian insurance because I don't want to have to wait a year for my knee replacement.
Yeah, well,
I have patients who never have a knee replacement because they can't afford the 20% that Medicare doesn't pay for.
Right.
A Canadian may have to wait a year, but 100% they're going to get it, and 100% is paid for.
Yeah.
And it's not driving you to the poorhouse to get it.
Yeah.
So, and it's not just with knee replacements, it's with a lot of things that we do.
Sure.
Like your husband's knuckle replacement. Before I could do that, I had to try therapy. And if they didn't pay for therapy, it's $70 an hour out of your pocket, or $70 a session out of your pocket. Not too many people could afford that. They have to have a prescription anti-inflammatory, not an over-the-counter one. It has to be a prescription one, right? They're not cheap, right? I have to inject it with steroids. If you're diabetic, that gives you risks, right? And it's contraindicated in most arthritises anyway. Particularly in the hand. So the insurance company makes us do this spin under the pretense of saving money, but they're really delaying care.
Right.
So, and if there's an insurance person out there that would like to argue with me about this in this venue, please sit next to me. I'd be happy to talk to you, because you're not on my end of it.
That's right.
And So we functionally deny health care in our country by making copays so absurdly high that the insurance companies laugh all the way to the bank.
That's right.
I tell my patients, go to any town and tell me what the tallest building is.
It's an insurance.
It's an insurance company or a bank. And insurance companies are banks.
Yep, you're right.
What do you think they do with your money?
Well, yeah.
Yeah,
well, I was hoping that was maybe kind of like written in the surgery procedure or something, because it makes me so mad, because people can benefit from physical therapy. They can get that. They don't have to take pain medicine. They can get back to where they need to be.
Absolutely. And there are some insurance vehicles, like Medicaid, that will pay for 2 therapy sessions.
I know.
I mean, we have my hand therapists at Nash are amazing. They're as good as I've worked with anywhere in the world, and better than most. As are the people at Select and other places in town. There's wonderful therapists all around town in modern physical therapy. There's absolutely amazing therapists. The truth of it is, if you can't get to them and if you can't afford them, you may be driving yourself to the operating room when you otherwise could have gotten better without surgery.
Right. It absolutely drives me crazy, because then, the insurance companies also limit you on how many, for instance, a strong narcotic pain pill, which some people need after surgery, you're limited in that.
I'm not totally against that. I think physicians are largely responsible for a lot of the drug addiction problem in the United States.
Yes, I agree with that, and I understand that, but sometimes you just need some.
Right. There's an appropriate use of narcotics, and there's a clear and inappropriate use of narcotics, but to not allow therapy to beat that dead horse, and there are multiple pain-lowering modalities.
Right.
While you're limiting pain medicine, makes no sense.
That's right.
Right? If you're going to limit pain-limiting modalities, then make them available by other measures.
Right. Because I know that the VA is, they've really looked at this, and they are authorizing more physical therapy, more chiropractic care.
As they should.
And because they're realizing that throwing all those opiates at these guys and gals is not doing anything but
Correct.
making them addicts.